Welcome to the NADIS Parasite Forecast for September 2020. Topics to be discussed this month include the summer fluke forecast, quarantine treatments of bought-in stock, parasitic gastroenteritis and blowfly strike in sheep, and parasitic gastroenteritis and lungworm infection in cattle. Weather report. July began with mainly cloudy weather, showers and longer spells of rainfall giving way to dry, sunny weather in southern England and latterly further north, although central and northern counties remained unsettled and often cloudy. The provisional UK mean temperature was 14.3 degrees centigrade, which is 0.8 degrees centigrade below the 1981 to 2010 long-term average. Below average temperatures were observed across all regions in July, although mean temperatures for the preceding 3 months from May to July remain above the long-term average for all regions. Rainfall was 122% of the average in July, and was notably a wet month in eastern and southwestern Scotland and northwest England. For the preceding 3 months from May to July, rainfall varied considerably between regions, with above average in Scotland, northwest England and Wales and Northern Ireland, and below average in central and east of England. Summer fluke forecast. The summer fluke forecast was published last month and is based on temperature and rainfall data from August to October 2019 and May to June 2020. This is predicting high risk in northwest Scotland and moderate risk across the rest of Scotland, Wales, Northern Ireland, northwest and southwest of England. Farmers in these areas should be vigilant for signs of disease, particularly if you have a known history of fluke infection and or if you have animals grazing fluky pastures. Advised actions therefore include monitoring for signs of disease, which includes sudden death in heavy infections, a general dullness, anemia and shortness of breath, and rapid weight loss with fluid accumulation such as bottle jaw. Consider routine diagnostic testing to monitor for levels of infection and risk of disease. In particular, monthly serum antibody responses in first season lambs and calves are a useful way of evaluating acute risk on your farm at this time. In addition, post-mortem of fallen stock and egg counts in older animals are also useful for monitoring for signs of disease, although it should be noted that fecal egg counts are not effective at detecting acute infections. Where acute disease occurs, treatment with triclobendazole is recommended, as this is the only product available that is effective against both adult and immature stages of the parasite. Due to growing concerns over drug resistance, it is also advised that such treatments are accompanied by resistance testing, and where drug failure is present or resistance suspected, veterinary advice is sought. Risk of infection can be reduced further by identifying high-risk fluky pastures on farms and avoid grazing these during peak risk periods. Fluky pastures are associated with the intermediate stage, the mud snail. These may be found in any damp, muddy areas of the farm, such as adjacent to permanent water bodies or in wet flushes, ditches and boggy areas. It is also important to note that pastures grazed previously by fluke-infected sheep should be considered a risk to cattle and vice versa. Quarantine treatments. When buying in new stock, it is important to remember that these animals can be a source of new parasites and or drug-resistant parasites, and as a consequence, quarantine measures should be undertaken when purchasing such animals. As with all anthelmintic dosing, it is important to check you are dosing correctly by weighing animals and calibrating your dosing equipment and weighing equipment prior to use, and administering treatments following the manufacturer's recommendations. For sheep, current gold standard practice concerning quarantine treatments are advised by the Sustainable Control of Parasites in Sheep or SCOPS group concerning roundworms, sheep scab and liver fluke. For additional details, please see the SCOPS group guidelines on quarantine treatments and seek veterinary advice. For cattle, the Control of Worms Sustainably or COWS group guidelines are generally based upon the principles of housing, treating and testing animals. For additional details, please see the Cows Group guidelines and liver fluke specific guidelines and speak to your vet or SQP. Parasitic gastroenteritis in sheep. The relatively warm and wet conditions experienced so far this season will have favoured larval development and dispersal onto pastures, whilst the relatively cool temperatures in July may have prolonged survival later into the season. Egg count data from the Parasite Watch in May to July shows variation across the UK, but moderate to high egg counts in all areas. Consequently, it is important to stay alert for signs of PGE. This is particularly important in groups of lambs grazing dirty pastures, namely those grazed by ewes earlier in the season or lambs over the previous season. It is also important to bear in mind hemonchosis at this time of year. Unlike other PGE-causing roundworms, the Barber's pole worm Haemonchus contortus affects both lambs and ewes. Advised actions therefore include monitoring for signs of disease. For animals with hemonchosis, it is important to note that these animals do not normally present with diarrhea, unlike other PGE-causing roundworms, and other clinical signs may appear similar to liver fluke infection, with signs including acute onset and anemia with general fatigue and edema and fluid accumulation such as bottle jaw. Where there is doubt, further diagnosis can be sought either through post-mortem or specialist worm egg count techniques. For more advice on this, please speak to your vet or SQP. To control PGE, consider the use of targeted selective treatments by monitoring performance indicators such as weight gain or worm egg counts. Ideally, these should be performed every 2 to 4 weeks. Generally, only 40 to 60% of lambs should require treatment based on weight gains, and you should aim to leave at least 10% of the flock untreated to reduce selection for anthelmintic resistance. Lambs grazing dirty pastures, consider dosing these and moving them to safe pastures such as silage aftermaths as they become available. However, when performing dose and move to reduce selection for anthelmintic resistance, it is advised that you leave animals on the dirty pastures for 2 to 3 days post-treatment and prior to moving. Avoid dosing with long-acting Group 3 macrocytic lactone products and leave at least 10% of the flock untreated. Where anthelmintic treatments are administered, it is also advised to check efficacy at 7 to 14 days post-treatment, depending upon the product used. For more information and advice on this, please see the SCOPS Group guidelines and seek the advice of your vet or SQP in sheep. The NADIS blowfly alert is updated every 2 weeks over the course of the grazing season. As of the end of July, this was predicting very high risk across the whole of England, Wales and Northern Ireland, and high risk in Scotland. Soiled back ends resulting from PGE and foot rot lesions are common sites for blowfly strike. Failure to treat promptly is a welfare issue and can lead to disrupted grazing, loss of condition, secondary infections and even death. Advised actions therefore include consulting the NADIS blowfly alert for up-to-date risk in your area, inspection of stock daily, dagging, crutching, shearing and prompt treatment of lame sheep, as well as good parasite control to reduce risk from blowfly strike, and use of a number of chemical formulations to aid in the prevention and treatment of blowfly strike as it occurs. For more information and advice on this, please speak to your vet or SQP. Parasitic gastroenteritis in cattle. PGE causing roundworms in cattle can remain on pastures in large numbers until the end of the grazing season. Young stock in their first grazing season may therefore still be at risk of type 1 osteotargiosis, particularly autumn and winter-born wean calves entering their first full grazing season, and spring-born beef suckler calves entering their second grazing season. Advised actions therefore include monitoring for signs of PGE in at-risk groups. Signs include loss of appetite, loss of weight and body condition, and profuse diarrhea. Animals which have been set stocked on the same pastures and received strategic dosing up until this point should be moved to safe pastures such as hay or silage aftermaths as they become available. Where strategic dosing has not been implemented, risk of disease peaks during the summer, but can remain high on previously grazed pastures until the end of the season. Monitoring of live weight gain and/or worm egg counts can help to identify infections and the effectiveness of your chosen control strategy over the course of the grazing season. Where dosing with anthelmintics is indicated, consider the cows group's 5 R's to ensure your worming strategy is both effective and sustainable. For more information and advice, please see the cows group guidelines on their website and speak with your vet or SQP. Lungworm infection in cattle. Risk of lungworm infection or husk in cattle peaks for animals' pastures in the late summer and autumn. Outbreaks are difficult to predict but may be associated with wetter summers and following periods of rainfall, as large numbers of infective larvae are dispersed from feces onto pastures. On farms with a history of lungworm infection, unvaccinated calves that have not been part of a strategic dosing program should be considered at risk of disease, as should older bought-in cattle from farms without a history of lungworm. Advised action therefore include monitoring for signs of infection, with early signs including widespread coughing within the group, initially after exercise and then at rest, increased respiratory rate and difficulty breathing, rapid loss of weight and body condition, milk drop in lactating cattle, and death in heavy infections. Where infection and disease is suspected, treat all animals within the affected group. Most roundworm products are effective against lungworm. Severely affected animals may also require additional treatments such as anti-inflammatories and antibiotics. Affected cattle should be removed from contaminated to safe pastures or housed in a well-ventilated building. Infection can be informed by further diagnostics such as post-mortem of dead animals, observation of larvae in saliva and fecal samples from patent infections, or a serum antibody ELISA. For more information and advice on this, please speak to your vet or SQP. This concludes the NADIS Parasite Forecast for September 2020. Thank you for listening, and we hope you have found this webinar useful. Please click on the link below to answer a short quiz, and then you can print your Advanced Livestock Skills Certificate. Join us next month for the next Parasite Forecast. The NADIS Parasite Forecast is published monthly and based on detailed Met Office data and additional parasitic data supplied by the Parasite Watch. There is a more detailed written forecast available on this website. We would like to thank Ben Strugnall from Farm Postmortems and Phil Scott for many of the images that appear in this webinar.